Hello everybody, welcome to my YouTube channel. My name is Stephanie Agbonkwe and I'm popularly known as Daughter of Zion. Okay, please, if this is your first time to stumble in my YouTube channel, please don't forget to like the video, share the video, subscribe to my YouTube channel and turn on your notification bell so you'll be notified when I upload a new video. Okay, hello everybody, welcome back to my YouTube channel. I'm happy to see you all. Happy weekend to everybody. Welcome to another episode of Health Talks. Okay, today we're still gonna be talking about health talk, and this is a very important topic. I bet you don't want to miss. Okay, so today we're gonna be talking about how to properly swallow pills. Okay, we're gonna be talking about how to properly swallow pills. Okay, so I'm gonna dive into it immediately. All right, so we all know what a pill is. Something that you use for the treatment of a disease, bacteria infections or whatever. So that is a pill. We all know what a pill is. Okay, so irrespective of the size, shape of the pills you are taking, you have to properly know how to swallow the pills for them to work the right way. Irrespective of the size, irrespective of the shape or color or whatever the pill might look like, you have to properly swallow these pills widely in order for them to perform their tasks correctly too. Okay, it is a two-way around. All right, so there is a right and a wrong way to take a pill. That is what a lot of people don't know. Okay, there is a right way and there is a wrong way to take a pill, and trust me, if you take the pills the right way, okay, it's gonna work. If you don't take it the right way, there are consequences too, just so you know. Okay, they can actually get stuck. You don't want to do this, because if you don't swallow a pill the right way, they can actually get stuck. Now I'm going to what will happen if you don't swallow pills the right way. Okay, we're going now to what is going to happen if you don't swallow pills the right way. Okay, they can actually get stuck in the esophagus. We all know the esophagus, right? They can actually get stuck in the esophagus. Okay, what are the right way for you to take pills? Okay, one of the consequences of not taking pills the right way is that they might actually get stuck on the esophagus, and you know what that means. All right, you feel discomfort and you are not really comfortable. It makes you feel not comfortable, and you know it can actually burn. I'm still going to talk on that, but let me tell you some of the right ways for you to take pills. Okay, firstly, take it with at least, I said at least, 8 ounces of water. Why? I mean, well, some people, I don't know if it's that they don't know, if it's ignorance, or they know and they're just being who they are. They don't want to follow instructions. Please, guys, just like how we go to school, we follow instructions from our professors, our teachers, our parents. The same way applies to pills. You have to follow instructions. One of the reasons why pills or medications don't work is because we don't follow instructions. I mean, we just be like, oh, it's a pill. If they ask me to take it once a day, I can take it twice a day. Before a doctor prescribe a pill and give you instructions, you have to follow them. If at all you want these pills to work properly, you need to take them the right way. Okay, the right way to take a pill, firstly, is by taking the pill with at least, some people take a pill with a whole bottle of water. That's still perfectly fine. As a matter of fact, water is important in the body. Okay, at least take your pills with at least 8 ounces of water. Why? I know people ask me, why should I take a pill with at least 8 ounces of water? Because if you don't take the pill, it can legally get stuck in the tube or the pipe getting down to your esophagus, and you don't want to do that. Okay, because if not, it will weigh you down. It will cause you discomfort and stuff like that. It can cause you pain, you know. So you want to take pills with at least 8 ounces of water, because if not, take pills with water. I mean, I've seen a lot of cases on a daily basis. Okay, I've seen a whole lot of different cases on a daily basis. I've seen where patients tell me, oh, give me them pills, and I give the patient the pill, and the patient just put it in the mouth, and before I know, the patient has swallowed the pill. I'm like, what? How in the world did he or she do that? But they do it. I mean, So, first thing that you want to know about taking pills widely is that you have to take pills with water. Room temperature water. I mean, this is not for all pills, but take pills with room temperature of water, okay? Why you want to take pills with water, firstly, is because if you don't take pills with water, it can get stuck on your throat. And when it gets stuck in your throat, it can get stuck in your throat or to the pipe leading to the esophagus. And you don't want pills to get stuck on your throat. How are you going to eat? How are you going to swallow spit or saliva? How are you going to do that, okay? And if you don't take pills the right way, it's going to lead you to chest pain, okay? I've seen people develop chest pain from taking pills with little or no water, and then it gets stuck in their throat or in the pipe leading to the esophagus, and they feel uncomfortable. I've seen people, don't get me twisted. I have seen people who take pills with little or no water, and it got to a point where they have to, operate them. I mean, you don't want to get to that level. You don't really want to get to that level, okay? Just take pills with water. It's going to save you a lot. It's going to save you from chest pain, okay? Yeah. Okay. So, like I was saying, if you don't take pills with water, little or no water, it can cause you chest pain, heartburns, feeling not comfortable, and the pill is still stuck in your throat or down to your esophagus. And that alone can damage your throat. It can damage your esophagus. Okay, you don't want to do that. If you don't take pills with water, it's going to damage your esophagus. And you know what it means for your esophagus to be damaged, okay? It does not only damage your esophagus, it damages the rest of the region. Okay, because like I said, one part leads to another. One disease causes this one to this one to this one to this one to this one. Okay, so put that in mind, okay? So, another thing that when it comes to pills taking the right way, what I want you to know is that follow instructions. Let me emphasize on this point, okay? Some medications don't work the way it should work because we don't follow instructions. When a physician, a doctor, or a nurse, or whatever be the case, give you a pill and tells you, take these pills 2 times a day, every 8 hours, or every 8 hours. Don't go and take it for 7.5 hours and you think it's cool. It's not. There is a reason why those instructions are there, because if it was okay, everybody would have been taking pills at their disposal. That is to tell you that if they give you an instruction, just like in church, just like how God instructs us to do the right thing in the right time, on the right time, and stuff like that. So everything has a protocol that we have to follow in order for it to work properly. All right? So please remember, if your doctor gives you instructions on pills, take it every 8 hours or after 8 hours. Please follow those instructions if you want those pills to work properly as they are supposed to work, okay? Many pills have a certain time of the day when you should consume it. But please avoid taking pills right before you sleep, especially at night. Give at least 15 to 20 minutes before your bedtime, or before you lay down for a sleep or a nap or whatever be the case. Certain pills have certain directions on when and what time of the day it should be taken. One of the ways you can properly consume a pill when you expect it to work the way it should work, it is if you take it rightly. There are certain pills, like I earlier mentioned, that specifically they are to be taken at a particular time of the day. But notwithstanding, if your doctor says take a pill morning, afternoon, and evening, I will advise you not to take a pill and go to bed immediately. You don't want to do that, okay? It is not advisable for you to take a pill and immediately after you take that pill, you rush in to go take a nap, to go sleep, or whatever be the case. You don't want to do that. I advise people, patients, at least to give a minimum of 15 to 20 minutes after taking a pill before laying down, okay? Please, let's follow instructions, okay? The reason why you don't really want to take a pill and just dive into bed is because when you take medications and immediately lay down flat, the pills can really the pill can really get caught. The pill can really get caught in your throat, and you don't need that because it will cause you more harm than good. People have different sleeping positions. There are people who sleep flat on their back. There are people who sleep on their side, and what have you. So I advise people to take pills to give it a minimum of 15 to 20 minutes before they lay down, be it for nighttime sleep or nap or whatever be the case. Please give it at least 15 to 20 minutes. It's not advisable to just take a pill. Even food, this goes same with food. It's not advisable for you to just take a pill to just eat and then you go straight to bed. It's not cool, okay? Please, let's do things the right way in order for them to work properly, okay? Take pills when you are upright, in like how I'm sitting. I'm sitting in an upright position or standing. You can be sitting in an upright position, anatomical position. Yeah, we call it anatomical position. Taking pills in an upright position. You can be sitting down like I'm sitting. You can be standing up. But just take pill when you are in an upright position. What the position that I'm sitting up right now is an upright position. This is how you should take your pills. It's either you're sitting down in an upright position or you are standing up in an upright position, an anatomical position, okay? So please take pills when you are upright. It can be when standing up, sitting down. Don't take your pills while you are laying down because it will make it harder for the pills to go down your throat and do the necessary functions, okay? Please, it really gets me upset when I see people taking pills while laying down or in other positions that are not healthy. The right and good way to take pills is sitting up in an upright position like what I'm sitting right now. I'm sitting in an upright position. You can be standing up, but just make sure you are not laying down and stuff like that. That is why in hospital we have this hospital bed for patients who cannot stand up or sit up, who are bed bound. They have a remote, they have a bed remote where we lift up their head at least about 90 degrees so that they feel like, they are in a sitting position where the pills can go down without any difficulties. Okay, you want to take pills when sitting in an upright position or in an anatomical position. Okay, so other than water, you can take pills with applesauce, pudding, and drop the pills in them. All right. So I have an aunt. I'm not gonna call her name because she knows herself already. I have an aunt while I was still a baby, a little girl was growing up. My aunt will never take pills, like swallowing them with water. It will not go down her throat. She doesn't just like pills, guys. What I see her do is she put the pills in her food and then she swallowed it. Those from us coming from Africa, you understand better. She would take a lump of fufu, open it, put the pills inside, arrange it, and then she will swallow. That's how she takes her own pill, which is totally fine. But let me let you know, not all pills can be taken that way, okay? Just so you know, not all pills can be taken that way. Hers, it was different because she had a doctor's order or the doctors gave an approval for her to take it that way. So we cannot compare. Just because she's taking that particular pill that way doesn't mean you can take it. I don't care if it's the same pill for the same purpose. Ask your doctor first because the both of you don't have the same health problem or health issue. So you want to double check that with your doctor before you get into that, okay? All right. Some people, like most of my residents, I crush their pills. Just so you know, again, not all pills are to be crushed, okay? There are some pills that are specifically on the label that says do not crush pills. Give pills in whole or in full. You can't break it, you can't crush it. So this is not applicable to all pills. Before you think of crushing your pills, breaking them into halves for you to easily swallow them, make sure you double check with your doctor because not all pills are to be crushed, okay? So that, just so you know, okay? Another thing is that you can also crush big pills, but check with your doctor, like what I already said, because not pills are to be crushed. I already mentioned that, okay? Get a pill cutter, and there is a line in the pill that breaks it, that can help you break it. In the hospital, we have a pill cutter. It's just like I don't have anything with me right now to demo it. But the precursor is just like, it's just a little stuff. It has a line on there that when you put the pill in there, you just press it and it's gonna break the pill into halves. Okay, it can be 2 or 3. So, but before you do that, remember to check with your doctor, because not all pills are to be crushed or are to be break. When you break them, it distort the function. Okay, so you wanna check that with your doctor too. Okay, check that with your doctor. Okay. Other method, let's say you are not okay with swallowing pills. You can't talk to, there are some people, like I said, my aunt, she's just not a pill person. She can't take pills, like she can't swallow. Just the taste is so awful for her. She don't want to swallow pills. That's just a big deal, okay? Whole story short, she don't like the sense of the pill or whatever be the case. She don't just like taking pills. Let's say you are just like my aunt. Who don't like pills? Who don't like to swallow pills? Remember, you can always talk to your doctor, and your doctor will see if they can change. Remember, pills, medication comes in different form. It can be liquid, it can be capsule, it can be tablet, it can be in powdered form. Medication comes in different sizes, okay? So just so you know. Other method, let's say you are not a pill person or you don't like swallowing pills, you can talk to your doctor, because pills come up in the form of liquid, cream, powder, tablet. So pill comes up in various shapes, size, or whatever be the case. So just so you know, talk to your doctor and see if, let's say for example, you have a, let's say you have, let me use a common example. Let's say you have let's say you have constipation. Yeah, that's a simple example. You have constipation and you are not a pill person, because we have DOK, Decosate, that you can use for constipation. We have stool softener that you can use for constipation. But let's say on the other hand, you don't like pills, you don't like tablet, you don't like capsule, because constipation, there is a pill. You have Decosate, you can use it. It comes in tablet, and then there's another one that comes in capsule. So let's say you are not a pill person, you don't like to swallow pill. We have Marilex. It also helps to stop your stool or make you have a bowel movement, okay? So talk to your doctor if you don't feel comfortable swallowing pills. Remember, talk to your doctor first, because remember, pills come in tablet, capsule, liquid, powder form. You just have to choose what works for you best. Just make sure you talk to your doctor, okay? Not applicable to all pills, but pills should not be left in the throat to dissolve, okay? This is not applicable to all pills, because there are some pills that the doctor will instruct you to put it either under your tongue or on top of your tongue and let it dissolve. Don't chew it, don't swallow it, just let it dissolve, okay? Well, most of the times those pills are pills for the throat or other medical conditions. But that's why I said not applicable to all pills. Listen, this is not applicable to all pills, but pills, if they don't give you instructions or specific instructions, pills should not be left in the throat to dissolve. Somebody will ask me, why did Stephanie say so? Okay, the reason is because a pill can bend the lining of the throat, causing also okay, I'm gonna take it one more time. Pills can cause a burn in your tongue or in your throat, okay? It can cause a condition what we call esophagitis, which is a condition where the esophagus become inflamed, and you don't want to do that, okay? So other than specific instruction on certain pills, okay, this is not applicable to all pills, but other than specific instructions to some particular pills should not be left on your tongue for it to dissolve, because it can cause esophagitis, which is a condition where the esophagus becomes inflamed, and you don't want to do that, okay? Sometimes when I talk about these, people ask me a lot of questions, especially on my TikTok. If you want to follow me there, okay, Stephanie. So especially on my TikTok, people ask me questions like, I'm going to read out some of the questions that when I post this video, a lot of people get to ask me. So I'm going to pose a question. If that was a question, okay, I answer it. But if that is not your question, feel free to leave it in the comment section below, okay? The first question that people ask me when I talk about this topic is that, is it okay to swallow a pill dry? That's what people ask me. No, and I told them no, it is not okay. Other than specific instruction on certain medication, it is not okay to swallow a pill dry because it harms the esophagus when you swallow a pill without water, because the tablet can cause a minor tear when the pill is going down your throat. There are some tablets, let's say for example, potassium chloride. Potassium chloride, from the best of my knowledge, I mean, I'm talking about a big one because it comes in different form. There's potassium chloride that is round and that is swallowable, you know. And there's a potassium chloride that is wide, like wide and big. That big pill can cause a tear in your throat, okay? And you don't want to do that. It can cause a tear in your throat. And just picture out your throat having a wound or a tear in it. First of all, you can't even swallow saliva spit. You can't even eat. So how are you gonna do? You don't want to do that, okay? So the question, I'm asking the question of, is it okay to swallow a pill dry? The answer is no. I just explained. It harms the esophagus when you swallow a pill without water, because a tablet can cause a minor tear when going down. So it's a no-no for that question, okay? Another thing I want you to bring to your attention is that avoid coffee, tea, cola, Coca-Cola, energy drinks, other sources of caffeine while taking medication, because they can add to the side effect of the caffeine. The caffeine can act to the side effect of the medication and worsen the whole situation, okay? I've seen people who take pills with soda, who take pills with coffee, who take pills with the best and right way to take pills is with water. Get it from me, okay? That's the only solvent that you can take pills with without no side effect. Please, please. You cannot be taking a pill for diabetes and you have soda in it. Come on now. Let's just be fair to our own body, okay? So please, I just want to bring that to your attention. What I was trying to say is that I'm just bringing this to your attention just so you know, okay? Okay, avoid coffee, caffeine, tea, Coca-Cola, energy drinks, or other sources of caffeine while taking medication, because they can actually add to the side effects of that medication, and you don't want to do that, okay? You don't want to take a medication tomorrow, you call the doctor, oh my back, I'm feeling back pain, I'm feeling chest pain. You are the cause of it, okay? Just so we know. Okay, another thing that I want to bring to your attention again is this, okay? For SEM-Med, SEM, for SEM-Med, it is not appropriate to take them while fizzy drinks, okay? Or carbonated soda, because it will cause the med to break down into mouth. Literally, the med will not dissolve, and of course will not explode, okay? Hence, it will not perform its function correctly, okay? This is just over the same thing. I just wrote it twice. So this last one is telling you that there are some medications that you cannot take them with any other liquid other than water, okay? So before you decide, I know some people like Dr. Pepper, orange soda, whatever be the case, Coca-Cola. Just so you know, don't take these pills except you notify your doctor that, hey, is it okay if I take this particular pill with Coca-Cola, Dr. Pepper, soda, or any other soft drinks? Because there are some pills that when you take them with this soda, carbonated drinks, or whatever be the case, it gets to affect you. The side effect become worsen. You don't want to get to that point, okay? So please, let us learn to take pills the right way if we want the pills to work the proper way, okay? Sometimes you take a pain pill. For the pain pill to relieve you from your pain, is the worsen the pain. Sometimes check yourself. You might be the cause, okay? Follow your doctor instruction. There's a reason why there's an instruction, because if it was just okay, just the way you think it's okay to take it with soda, if it was just okay, there wouldn't have been any need for the doctor to write directions or instructions on what to follow. So guys, this is all what I have for you today. I hope you enjoyed the video. Leave in the comment section below what's your best method of drinking your pills, or how you take your pills, and what's your opinion about the video. Please, like I said, don't forget turn on your notification bell, subscribe to my YouTube channel, like the video, share the video, and your comment on the comment section below is highly needed. I want to thank you all for supporting me. I want to thank you for watching the video. If you have any concern, any problem, any difficulties, if you have anything, just put in the comment section below and I'll get to that immediately. Thank you guys for showing me love. I appreciate you. Turn on your notification bell so you'll be notified when I upload a new video. And please don't forget to share the video. Love you guys. See you in the next video. It won't take long. Watch out for that.